Here's something that might surprise you. The antidepressant you're taking could be raising your blood pressure by 11 millimeters of mercury, changing your heart rate by over 20 beats per minute, or causing you to gain nearly 4 kilograms. And it has nothing to do with how well it's treating your depression. I'm Dr. Ferghal Armstrong, and today we're diving into groundbreaking research that changes how we should think about antidepressant side effects. A massive new study published in The Lancet just analyzed data from nearly 60,000 people across 151 clinical trials, comparing 30 different antidepressants. And what they found is frankly astonishing. Not all antidepressants are created equal when it comes to your metabolic health. Let me give you the headline findings. First, weight changes vary dramatically. Some antidepressants like agomelatine actually help you lose weight, while others like meprotilene or amitriptyline cause clinically significant weight gain in almost half of patients taking them. We're talking about 4 kilogram difference between the best and the worst performers. Second, cardiovascular side effects are all over the map. The difference in heart rate changes between fluvoxamine and nortriptyline over 21 beats per minute. Nortriptyline can increase your heart rate by nearly 14 beats per minute, whilst fluvoxamine actually decreases it by 8. Blood pressure tells a similar story. Systolic blood pressure differences exceed 11 millimeters of mercury between different medications. And here's what this means for you. Every beat increase in heart rate is associated with a 3% higher risk of all-cause death in men over 50. Every 1 millimeter of mercury increase in untreated systolic blood pressure increases stroke death risk by 1%. These are not trivial numbers. Now, here's where it gets really interesting and a bit counterintuitive. Some antidepressants like duloxetine, venlafaxine, desvenlafaxine, and paroxetine actually reduced body weight, which sounds great, but paradoxically, they increased cholesterol levels and, in duloxetine's case, glucose levels as well. This challenges the simple narrative that weight gain is the only metabolic concern. The researchers also discovered important risk factors. If you're carrying extra weight at baseline, you're more likely to experience larger increases in blood pressure and liver enzymes from antidepressants. If you're older, you're more susceptible to glucose increases. This is where personalized medicine really matters. And here's something that should reassure patients. The study found no correlation between how much your depression improved and whether you experienced metabolic side effects. So you don't have to choose between feeling better mentally and protecting your physical health. They are independent. So what should you do with this information? 3 things. Firstly, have an honest conversation with your prescriber. Don't just ask which antidepressant is best. Ask which antidepressant is best for my specific metabolic risk profile. If you already have high blood pressure, avoiding SNRIs might be wise. If you're struggling with weight, medications like agomelatine, moclobemide, or fluoxetine might be better choices than mirtazapine or tricyclics. Second, monitor your metrics. Get baseline measurements of weight, blood pressure, heart rate, glucose, and cholesterol before starting any antidepressants. Then recheck at 8 to 12 weeks. This is standard practice with antipsychotics, but is often neglected with antidepressants. And third, remember that lifestyle interventions work synergistically. Even if your antidepressant causes modest metabolic changes, regular exercise, good sleep, and a Mediterranean-style diet can offset many of these effects. In my work in lifestyle medicine, I've seen patients completely reverse medication-induced metabolic changes through targeted lifestyle interventions. The bottom line, now we have solid evidence to guide smarter, more personalized antidepressant prescribing. If you're on an antidepressant or considering one, use this information to advocate for yourself. Your mental health matters, but so does your metabolic health. And with the right approach, you can optimize both. For more evidence-based health insights, subscribe to MedHeads. I'm Dr. Ferghal Armstrong. Thanks for listening.